Hi, my name is John Thomas. I'm a physical therapist at Laguna Orthopedic Rehabilitation. Over the next month, I want to discuss common injuries seen in the runner. The first one I'd like to talk about is called IT band syndrome. The IT band is an extension from the tensor fasciae lata, which is a muscle alongside of the hip. This IT band is a fascial sheath that encompasses the quadriceps and hamstrings and inserts into the tibia by the Gerdy's tubercle. What happens with runners many times is they may report pain distal or proximal along this IT band, specifically along this lateral side, which is the thickest portion of the IT band. Many times their symptoms are a result of poor biomechanics in their running. The most common thing I see in runners is as they load, their pelvis may collapse or their knee may break midline. What this causes is a repetitive pulling of that IT band, resulting in pain proximal or distal. When I evaluate the runner, many times I find muscle strength imbalances in their hip, specifically in the gluteus maximus, the posterior muscle in the hip, or the gluteus medius, the lateral muscle along the hip. These muscles allow stability in the pelvis and prevent the femur from rotating inward. There was a recent article done in Journal of Sports and Orthopedic Physical Therapy, February of 2013, that found the best ways to strengthen these muscles. What they did was inserted fine wire EMG into the gluteus medius, maximus, and TFL to find out which muscles allow the glutes to contract without engaging the TFL. I'm going to show you those 5 muscle group exercises today. The first one I want to start with is the single leg bridge. You're lying on your back, your knees are bent, your feet are flat, you're extending your hips and straightening your leg, keeping your pelvis level. The next exercise is called the clam. You lie on your side, your hips are stacked, your pelvis is level, you engage the gluteus medius muscle, tightening the hip, open the knees apart. You want to make sure that you're not feeling the muscle contract in the front of the hip or along the side. Number 3, you're on your hands and knees, and you extend your hip out with your knee bent. Number 4, you straighten your knee, and you perform the same exercise, extending the hip up, parallel with the trunk, and making sure not to arch your back. The last exercise I want to show you is called lateral stepping. This is an extension of the clam exercise. It's performed in a weight-bearing position. You perform lateral steps to the side. You can put resistance around your knees. Toes are pointed forward. You want to make sure that when you step to the side, your stance limb does not collapse medial. That's all I wanted to show you today. Join me next week for other exercises to address common injuries in the runner. Thank you.